And good morning and welcome. I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning, Dr. Cheryl Miller. Dr. Cheryl Miller is a family practice specialist. If you have any questions for Dr. Sherry in the future, any of my other guests, two ways to reach me. You can reach me through my foundation, that's needfoundation.org, or fax 696-9012. I'd like to talk about one unifying concept to relate the decreased access to care and yet the increasing costs of health care. I'm going to say it right now, decreased access to care and increasing costs of health care is due to one thing, and that's government fiduciary irresponsibility of funds that they've had. Let's get right down to it. Next year, it's official, physician fees will be cut as an average 10.1%. Now, that means not everybody's 10%. For example, if you have a kidney doctor, he'll be cut 14%. If you have a family doctor, they'll be cut 8%. Orthopedists, 12%. But basically, it's a cut across the board based on the Medicare formula. Now, I'm not whining. I'm just telling you, as a patient, you now have a problem. 60% of physicians next year say they are going to start curtailing Medicare. Not seeing new Medicare or not taking any Medicare at all. That's called access to health care problem. Now, what happened? Well, here's where the government fiduciary irresponsibility came in. They had all sorts of monies at one point to save up for the aging baby boomers, and it never happened. In 1970, 80% of the Medicare funds that the federal government received were in excess of the money they spent on Medicare. And they had that money, so what did they do with that money? They spent that money on other things. They didn't save it. Yes, there is a Medicare Trust fund, but all that is the IOU the government owes back to the trust fund, which is going to be paid for by taxpayers. Now, they had an excess in Medicare funds up until last year. So, let's say it started in 1965, 1975, 1985, 1995, 2005. They had 40 years of excess money coming into the Medicare so-called trust fund. 40 years. Vaporized. Gone. It's now all IOUs, bonds or IOU trust fund dollars. So this is in face of the Medicare flawed formula they have to pay physicians and also hospitals. Now, this formula that they have in Medicare is based on a budget neutrality and also a penalty basically for any overutilization from the previous year. In other words, if the previous year physicians spent 5 to 10% or caused 5 to 10% more expense than they planned, then the following year it's going to get put into the formula so the government can sort of get it back in a so-called budget neutral fashion. The idea being basically to teach physicians don't overutilize. But folks, that's not what's happening. The reason there's more and more use each year of monies is because there's more and more Medicare recipients. And there's more and more older Medicare recipients, and older Medicare recipients require more fund usage than younger Medicare recipients. Why are there more older ones? Because doctors are pretty good and people are living longer. So now you got 90-year-olds versus 65-year-olds. They take more maintenance, sort of like a 53 Chevy versus a 73 Chevy. More maintenance. So what's happened is if you have one hip fracture predicted in 1990 going to 6 hip fractures in the year 2030, that's a growth problem, not due to overutilization, but to the word just plain utilization. In other words, there's more elderly, more people breaking their hips, 600% more in that time span. That growth is about 5% a year. Add to that new drugs, technology, increasing trauma, you name it, and you have an 8% or 9% growth problem in healthcare each year across the board. That's not counting inflation. You want to add inflation? Let's just say it's an even 10%. So every year you're going to have a 10% increase in demand. Now the government knew this. Now how would they have saved it? They should have taken that 40 years of excess funds and saved it for that aging increased demand. Instead, poof, it's gone. Money's not there. We go to the formula. Docs get the cuts and they quit seeing the folks. Now you say 10%, docs can deal with that. I'll tell you what that means. If you have an office, a family practice office is an average of an 80% overhead, and you take away 10%, you have cut that physician's pay in half if they see Medicare. You do it 2 years in a row, they receive nothing. Who in their right mind is going to work for nothing? It ain't going to happen. I'm case in point. My accountant told me you can't do total hips next year for this 10% cut. You'll be losing $500 a case. I said, how could this be? I get $1,000. He said, how long does it take you to do total hip? Well, total time in the hospital is 2 hours. And you make rounds. Yes, 3 days. That's another hour. That's 3 hours. And you see the patient free for 3 months. Yes, that's another hour. That's 4 hours of work. He said, that's half a day. What's your overhead for half a day as an orthopedist? I said, about $1,500. He says, you're getting $1,000 from the government. So you're doing a high-risk procedure. You're getting $1,000. It's costing you $1,500. Quit doing it. Something to think about. Now, I said this reflects across everybody, access, costs, etc. Young people, as a result of this fiduciary irresponsibility, are paying more than they should for their health costs. Why? The government doesn't pay enough to the hospitals for Medicare patients. Hospitals then bump up the prices of young people when they go in for their procedures. What happens to that young person's health care costs? Well, their insurance rises because of the increased hits to them. They're paying more than they should. So they can't afford it. Problem. They keep saying, folks, you hear the congressman, we need to fix this. We need to fix this. No, we don't. We need to get these guys back and hold them responsible for having spent that excess money. And maybe take their retirement funds that they're going to get when they relieve and put it back into the trust fund. That's real cash. These are my opinions. Any comments? 2 ways to reach me. Reach me through my exciting new web, needfoundation.org, or fax 696-9012 to ask the doctor.
Hi, I'm Danielle. I injured my knee back in February, but thanks to the foundation, I'll be playing again.
I'm Dr. Peter Holmes. The Orthopedic Need Foundation was formed to help those families who are underinsured or uninsured return their athlete to their sport. Please help us to return kids back to their sport after injuries like this.
You can send your donations online at www.needfoundations.org or call 210-542-1722. All donations are tax deductible. Make a difference in a child's life.
Woo!